Welcome, everyone, to the RFP pre-solicitation conference for RFP number 9661, Harm Reduction Services out of the Chicago Department of Public Health. My name is Sarah Richardson. We are recording this presentation and it will be posted to FMPS. Here's our agenda. We have 1 hour together today. We'll start with welcome and introductions, and then I'm basically going to walk through the RFP so that from purpose and goals all the way through to evaluation rubric, all of that information is sort of laying out what we're asking for in the RFP. Then we'll talk about key dates and questions. At the end, we're going to have time for open questions. You can unmute yourself and ask questions. Please feel free to use the chat as we go to type in questions. All of the questions that you ask in the chat and verbally, we are recording and we will post as part of the Q&A on FMPS as part of this funding opportunity. And I've got a couple folks from CDPH on the line recording all of your questions. So as I said, my name is Sarah Richardson. I'm a program manager here in the Office of Substance Use at the Chicago Department of Public Health. I will be running this bidders conference. Again, put your questions in the chat. We will have time for questions at the end. You can follow up after this presentation with more questions. If you have them, the deadline for those questions is October 11th at 12 p.m. After that point, we will compile all questions and answers and put that document up on FMPS for everyone's viewing. And again, this presentation is recorded and the recording will also be posted to FMPS and the CDPH YouTube channel for folks to view. This presentation is a summary of the RFP document. If there are any discrepancies, please always follow the RFP for a full listing of all requirements and expectations. All right, so starting with the purpose and goals of this funding opportunity, CDPH is seeking to expand the drug checking infrastructure in Chicago to support a citywide network of low barrier drug checking services delivered together with overdose education and naloxone distribution outreach. We have 3 primary goals of this funding opportunity. The first is to increase access to that low barrier trauma-informed harm reduction services for people who use drugs. Number 2, to monitor trends in Chicago's drug supply to inform public health programs that keep individuals and communities safer. And number 3, to reduce the number of fatal and non-fatal overdoses in the city. We have funding available for up to 4 agencies, and the funding period is 5 years. The general program overview is to establish a new drug checking program or continue an existing drug checking program that is integrated into a harm reduction outreach program. Respondents must serve areas of Chicago that are most affected by drug overdose, and we will dig into what that means in a minute, and employ trauma-informed low-barrier outreach and engagement approaches that are tailored to the needs of communities served. These are the required activities of all awardees. So whether you are applying as to start a new drug checking program or continue an existing program, all respondents must incorporate all of these required activities into your work plan and application. The first is to operate a drug checking program that utilizes an FTIR, which is a Fourier transform infrared spectroscopy machine, we just call FTIR, as well as other drug checking equipment deemed necessary to provide direct outreach and drug checking services to priority communities. You must include people with lived experience of substance use disorder, and/or overdose recovery in the program design and implementation. You must develop outreach strategies that include naloxone distribution and overdose education. You must respond with your program to overdose spike alerts issued by CDPH when and if feasible, with harm reduction outreach and drug checking services. You must distribute fentanyl test strips, xylazine test strips, and other point-of-care drug testing supplies to individuals and provide education on the use of these tools. And you must provide consultation and interpretation on the results of drug checking services to program participants. The final required activities for all awardees, are to provide linkage to other harm reduction services like medication-assisted recovery or other substance use treatment services, and referrals to social services for all participants when and if they need that. So setting up those referral mechanisms and linkage to care within your program. Participate in a CDPH convened quarterly learning collaborative with the other funded drug checking agencies to develop a community of practice around drug checking in Chicago. Report de-identified drug checking data to CDPH on a monthly basis using a data template that is provided by CDPH. All funded agencies will use the same data template, and work with CDPH to develop communications materials around your drug checking program, harm reduction resources, and that aggregate drug checking data. Please note that everything I've just mentioned and described, you must include and account for in the 12-month work plan that you must submit as part of your application. Now, we do have a little bit of a breakdown between those agencies that are applying and they already operate a drug checking program and those agencies that are applying to start a new drug checking program. So for those agencies that have an existing drug checking program, we expect that beginning in the first month of the contract award, you will be able to test and report on at least 40 samples per month, sending that de-identified results to CDPH in the monthly data report. For new programs, we acknowledge that you do not have an existing program and cannot begin drug checking in month 1 of the award. And so we've set it up so that the first year of the award is really when you are staffing up your program, purchasing the materials and equipment and learning to do this. And so by the start of year 2, we expect that you test at least 20 samples per month and send those results to CDPH in the monthly reporting template. And then at the start of year 3, test and report on a minimum of 40 samples per month. If agencies are able to report before those deadlines or report more than those, that is wonderful, but these are our required metrics to meet. And at the bottom here, we want to note all programs must work to ensure to the best of their ability that at least 70% of the samples tested using this funding are collected within the city of Chicago. This is City of Chicago funding. Thinking about program overview and design, applicants can propose service delivery modalities that meet the needs of the community that you are proposing to serve. So that can include, but is not limited to, a fixed site program operating out of some static site, and or mobile outreach from vans or street outreach, and or tabling and outreach at community events, the use of drop boxes for sample collection, partnerships with other agencies to conduct outreach and or have them collect samples and work with you on testing. You must describe the way that you plan to deliver services and how that service delivery modality is tailored to the needs of the communities that you are seeking to serve. And we do encourage, and this is in the RFP, co-location and partnership among multiple agencies to ensure that drug checking services are accessible. All CDPH investments are guided by these principles. Delegate agencies and their subcontractors are expected to integrate these principles into organizational policy and practice. You are asked in the application to respond explicitly to all 4 of these within the program design. Deconstructing racist systems, actively working to reframe and dismantle systems that perpetuate privilege, trauma prevention and trauma-informed services, ensuring services address trauma and healing. You are asked in the application to explicitly define what trauma-informed means to you and your agency and the program design. Cultural responsiveness, ensuring services are culturally and linguistically appropriate. The same for that. You will be asked to explicitly define for us what that means for you and how you embody that in your organization. And then health equity in all communities, allocating resources and services to people and areas with the greatest need. There are some things that this funding may not fund. The first is the purchase of naloxone or Narcan. This is both a stipulation of some of the funding sources that fund this award, but also that in Illinois, we have access to naloxone through the drug overdose prevention program through the state, and we encourage all agencies to register and get their naloxone through that funding source. You may not use this funding source to purchase naloxone. You may also not purchase syringes, cookers, pipes, or other safer use supplies due to the federal nature of the funding source. You may not purchase drug disposal bags, or any type of drug disposal or take back programs can be funded. You may not purchase a mass spectrometry machine, provision of direct medical care by medical professionals, and provision of substance use treatment, including MAR and medications to treat substance use disorders, are unallowable costs. Okay, shifting now to geographic coverage. We have two requirements around geography in your scope of services. The first is that you must propose a service delivery model that provides these services, outreach and drug checking, in a minimum of 3 community areas. And secondly, at least one of those 3 community areas must be a first, second, or third priority community area, which I will show you on the next slides. If you are not able to meet both of these requirements, oops, folks can please mute. If you're not able to meet both of these requirements, your application will not be scored. And of course, you can propose serving more than 3 community areas, and you can propose serving community areas outside of the prioritized communities, as long as these 2 requirements are met. So there's a lot of information on this slide, but this is breaking down how we are scoring and allocating points and what the community areas are. So on the right here is a map of the city of Chicago, and the data that is being shown are EMS responses for opioid overdose in 2022. Over the whole city in that year, there were 11,274 EMS responses for opioid overdose. And what we have done is broken down the community areas shown here into first, second, and third priority based on the number of opioid-related overdose responses in those areas. And so the first priority communities are those with the highest numbers of opioid overdoses responded to by 911. And those are the darkest blue community areas, the blue shaded like Austin, Humboldt Park, West Garfield Park, South Shore, that dark blue. If you propose services that include at least one of those community areas, you will receive 6 points in the geographic coverage section of the rubric. The second group is our second priority community areas. So they have really high, but not the most number of opioid-related overdose responses, and that is that medium blue. I'll show you a breakdown of the actual numbers. I know sometimes the map can be hard to read, but it's that medium blue of like the near north side, the Loop, Grand Boulevard, Englewood, Greater Grand Crossing, that color. If you propose services in one of those areas, but not any first priority communities, then you're eligible for 4 points. And then the third priority are the lighter blue, like the color of the Lower West Side, New City, Douglas, Westtown. And those are our third priority communities. And if you propose providing services in those communities, but no first or second priority communities, you're eligible for 2 points. If you're proposing services in not a single one of our first, second, or third priority community areas, you're not eligible for your application to be scored. I won't read every single one of these, but I will pause for a moment on this slide so it is captured in the recording. This is the full list is available on page 4 of the RFP, and I should have said that map is available on page 6 of the RFP. These are the lists of the first, second, and third priority community areas and their corresponding number of EMS responses. Okay. We will transition now to available funding. $1 million is available for the initial contract term of 12 months with up to 4 12-month extensions, so a 5-year period. We are looking to fund up to 4 applicants, each at about $250,000 for the initial 12-month period. This funding comes from the CDC's Overdose Data to Action local grant. and some opioid settlement funds. And it is very likely that awardees will receive funding from both of those sources, which is what we call braided funding in the city. The program budget that you submit to us cannot exceed the available funding amount of $250,000 for each agency. On data and reporting, so funded agencies are expected to report monthly de-identified drug checking data to CDPH, which will include at minimum how that sample was acquired, whether in person, a drop box, a partner organization, or any other ways, the date that the sample was tested, the zip code where the sample was collected, and the test results. There is, of course, other information and data that can be collected, which includes what the sample was sold as, non-identifying demographics of participants submitting the samples, the method of ingestion, notes on the experience of using the tested substance. So after award, CDPH will work with awarded agencies on the data tool, and you should be expecting to submit that for current programs that already run drug checking from month one. And for new programs starting in year two, month one of year two would be submitting that data reporting to CDPH. In terms of program evaluation, in the application, we are asking you to propose to us a program evaluation plan that includes a list of specific performance measures that you believe will work to measure the successful implementation of your program. Please provide, this is asked for explicitly, a specific list of measures that you are intending to use. The process for collecting, maintaining, and analyzing any client, participant, or patient level data, your data privacy and security policies, the capacity that your team has for performing data collection and quality improvement based off of your learnings from the data, and how you will use that list of performance measures and the collected data for continuous quality improvement. Thinking about staffing, this funding can support a wide array of staff involved in this program. Anything drug checking technicians, outreach staff, community health workers, program leadership or management staff at any level, data analysis, quality assurance personnel, grants administration. The staff that you need to operate this program should be included fully in the budget and in your work plan. We do absolutely require that people with lived experience, whether or not they are working as a certified peer recovery specialist, participate in the design and implementation of the program. And this funding may absolutely be used to support the certification of any peer recovery specialists on your team that want to become kind of officially certified as a CPRS. All staff oh, I see a question in the chat. Yes, Melina. So the question is, can you please confirm that the purchase of FTIR is allowable? I understand mass spec machines are not. Thank you. Yes, an FTIR is allowable, and we are requiring that programs use an FTIR in their drug checking. Thank you for that clarification. So all staff funded under this award must be compensated at a minimum of $20 an hour, and this must be reflected in the proposed budget. Staff are not permitted to serve as volunteers under this funding. Their time must be compensated for the time worked, their skill level, their lived experience, and their expertise. And your applications must describe how many staff and break it down by part-time, full-time, hourly will be funded under the award. And be very explicit about their role, their title, time allocation in the application. If one or more agencies will serve as subcontractors to the applicant, you have to be specific in outlining the staffing plans for each subcontractor. Subcontracting is allowed under this award. Eligibility requirements. So respondents must meet the following criteria to be eligible for this award. You must have an office located in the city of Chicago from which your agency offers services. You must be in good standing with the city of Chicago, have the administrative, organizational, programmatic, information technology, and fiscal capability to plan, develop, implement, and evaluate the proposed project. Agencies with a limited capacity to administer the fiscal responsibilities associated with their programs can subcontract with a fiscal and reporting agency to provide administrative services. As discussed, you must propose a program model that serves at least 3 community areas, and you must propose a program model that provides direct harm reduction outreach and drug checking services in at least one priority 1, 2, or 3 community area that we discussed above. And finally, and I haven't discussed this yet, you must be a registered syringe service program or SSP with the Illinois Department of Human Services at the time of application or demonstrate an ability to be registered by the contract start date. You will be asked explicitly in the application to discuss this or prove your registration. And it is free. You can just access the application online through IDHS. And this is because Illinois law allows drug checking, but you must be registered as an SSP to be covered in that space. I guess I should pause. There's a question in the chat. How would master level interns be classified if assigned to this project? Can you provide a little more clarification on your question? What do you mean by classified?
Can I come off of mute? So the
Sure.
question is, we would assign master's level graduate student interns for this project, but they cannot, I understand that they cannot be volunteers, but our interns cannot be paid either. So would they be allowed to work on this project, or should we think of other staffing?
I'm writing down your question. That's a good question, and I will have to go ask our contracts team if there's a space between volunteer and intern. So I don't have an answer for you right now, but the answer, I'll reflect it in the Q&A document. Thank you. Okay, the ideal applicant is also able to meet the following criteria, which are reflected in the various questions we ask you in the application. So a demonstrated history of providing services to participants, regardless of their ability to pay, their health insurance status, or their immigration status. All services under this funding must be provided in that manner. A demonstrated history of providing services that are responsive to the unique needs of communities of high need, and that includes delivering services that are culturally, contextually, and linguistically responsive to the unique needs of people who use drugs and people at high risk of experiencing an overdose. A commitment to delivering services that recognize the impact of trauma on individuals, communities, and across generations. A commitment to delivering services that are evidence-based or evidence-informed, and this can be demonstrated both through proposing the use of interventions that have been demonstrated to be effective in generating the outcomes that the agency proposes in their application. A commitment to centering the lives and experiences of people with lived experience of substance use, use disorder, and overdose in program design, leadership, and implementation, and a demonstrated history of working with people who use drugs in Chicago through low barrier, non-judgmental, non-coercive programs and interventions. This is the evaluation rubric. It is posted on page 19 and 20 of the RFP. Experience and capacity is 20 points are available for experience and capacity, providing harm reduction services in Chicago. 24 points are available for your project description, which includes the work plan. 18 points are available for the staffing plan, which includes a separately uploaded staffing plan document and responses to questions. 6 points for the budget and justification. 16 points for your evaluation and data collection plan. 2 points for fiscal capacity. 6 points, and we walked through that breakdown for geographic area. And then 8 points for your alignment with our CDPH principles. This is my last slide and then can open up to questions. So the RFP was released on September 25th. Today is October 5th at 2 p.m. That is the bidders conference. The deadline for questions is the 11th at 12 p.m. And once that deadline passes, we will post the Q&A document to FMPS. This recording will also be posted to FMPS, I think, before the 11th. And then the RFP deadline is October 26th at 12 p.m. And we are really aiming for a contract start date of November 1st, which is a tight turnaround, but that is the goal. Okay, I will open it up now to questions. Another question in the chat. Another question, which professions usually uses the FTIR? Who actually does the testing on that machine? So typically that is a drug checking technician who is specially trained to use an FTIR and also to engage folks who use drugs and are bringing in samples to interpret the results and work with people in a harm reduction manner. I apologize for the noise. Um, Other questions, you can put them in the chat or unmute yourself at this time and just jump in. Can we put indirect costs in the budget? Yes, you should put indirect costs in the budget and indicate what your agency's indirect cost rate is. Next question, is the expectation that the grantees will use grant funds to secure FTIR training for techs? Yeah, so for programs that do not currently operate a drug checking program, the purchase of the FTIR and requiring of that technology in some way, and then the training of staff to use that technology is really what you're using the first year for. So it is an expectation of sort of the hiring of those staff and ensuring that they are trained in year one. Melina, will agencies be allowed to backdate expenses to 11/1, or will it just be from the date of contract? The agencies will be able to expense to the date of the letter of award, and we are aiming for that date to be November 1. Tate, can you use funds to purchase a mobile service vehicle? Yes, you can use funds to purchase a vehicle. We will be clear with you that, like, as I said, there are two funding, I don't know how far back that is, two funding sources. One of them would be able to purchase a vehicle. Um, so if that is part of the plan and a delegate agency is awarded funding, we will work with you on that.
I'm not sure if you saw my question, but I was wondering where the recording of this bidding conference will be located.
Sorry, I missed that. Sorry. Yeah, so it will be up on the CDPH YouTube channel, which you should just be able to Google Chicago Department of Public Health YouTube, and it will also be within FMPS attached to this RFP. So anyone interested in applying to this RFP, you need to make an account within FMPS on the city's site, and then you'll be able to log in and see both the Q&A and the RFP and this recording. Okay, another question. I read that the turnaround time is around 7 days to find out if registration as an SSP was successful. Can you confirm? Yeah, so that's a state process. I've heard of it happening in even less time. But yeah, I think 7 days seems pretty accurate. You would want to reach out directly to IDHS on that. It's not a complicated process at all to register as an SSP. Yeah, thanks everyone. I'm going to just wait for any final questions to trickle in the next couple minutes. If you don't have any, feel free to sign off or just wait. We'll give it maybe 4 or 5 more minutes. Okay, as much as I love sitting in silence with all of you, I'm going to end the meeting. You all have my email and phone number on the RFP and can reach out with questions. Thank you all for attending and yeah, thank you.